Hello, this is Dr. Morris. I am continuing the lecture series in microbiology. Today we'll be discussing microbial diseases of the skin and the eyes. The first line of defense in the body is the skin, or the integumentary system, and the mucous membranes which line the cavities of the integumentary system. Recently it was found that perspiration contains an antimicrobial peptide. This peptide is referred to as dermiticin. The epidermis is the outer, thinner portion of the skin. It is composed of several layers of epithelial cells. The outermost epidermal layer, the stratum corneum, consists mainly of dead cells which contain a protein referred to as keratin. The inner layer of skin is the dermis. It is composed of connective tissue with numerous blood and lymph vessels, nerves, hair follicles, and sweat and oil glands. Perspiration provides moisture necessary for microbial growth. However, salts interfere with growth of many microorganisms, and the enzyme lysozyme in perspiration digests the cell walls of many bacteria. Sebum from oil glands is mainly a mixture of unsaturated fatty acids, proteins, and salts. The fatty acids inhibit the growth of certain pathogens. Just as a review, salt inhibits microbes. Lysozymes, the lysozymes that are in this salt or this sweat, hydrolyzes the peptidoglycans of antimicrobial, or I should restate that, the lysozymes hydrolyze the peptidoglycan cell walls of invading microorganisms. Fatty acids inhibit some pathogens that grow. In the lining of the body cavities, such as the mouth, nasal passageways, urinary, genital tract, and the gastrointestinal tract, there is a layer of specialized epithelial cells which attach at their bases a layer of the extracellular material called the basement membrane. Some cells produce mucus. This mucus traps particles including microbes, hence the name mucous membrane. We discussed this when we talked about the non-specific host defenses in earlier chapters. Other cells are ciliated, and they function as sweep particles from the mucus around the body. Again, this was discussed when we talked about the mucociliary lining of the respiratory tract. Again, as a review, mucous membranes line body cavities. Again, we see that in the oral mucosa, the gastrointestinal tract, in the reproductive organs as well. Epithelial cells attach to the extracellular matrix. These cells will secrete mucus. Some have cilia, such as in the respiratory system, which will help move the mucus from the deeper recesses of the lungs to the outside environment, where the fluid would be expectorated or swallowed into the gastrointestinal tract, where digestive enzymes would destroy microorganisms. Many bacteria are gram-positive spherical bacteria, such as Staphylococcus and Micrococcus. Gram-positive pleomorphic rods, diphtheroides, such as Propionic bacterium acnes, metabolizes the sebum secretion in the hair follicles. Acid produced by them keeps the skin pH between a level of 3 to 5, a condition that tends to be bacteriostatic in nature. Other diphtheroides, such as Corynebacterium xerosis, are aerobic. The yeast, this is Pipisporum ovale, which grows on oily skin secretions. High moisture regions, such as the armpits between the legs, are moist enough to support the growth of microorganisms, and populations are high as compared to dry regions of the head, such as the scalp. Again, as a review, gram-positive, salt-tolerant bacteria exist on the skin: Staphylococcus, Micrococcus, and diphtheroides. Now, diphtheroides, again, is a rod-like or rod-shaped organism. Now, let's talk about some of the findings that you can see on the skin that would represent an invasion of microorganisms. There are certain manifestations on the skin that are recognizable when a microorganism has invaded into the integumentary system. These are vesicles, which are small fluid-filled lesions on the skin. Skin vesicles larger than about 1 centimeter in diameter are referred to as bullae. Flat, reddened lesions are referred to as macules, and then raised lesions are called papules or pustules when they contain pus. A skin rash that arises from a disease condition is called an exanthem. Now, exanthems are seen on the skin. obviously visualized. On the mucous membrane, those membranes that are inside cavities, such as inside the mouth, that presentation or skin lesion or rash is referred to as a enanthem. Again, two terms, exanthem and enanthem, and you should be familiar with those two terms. Again, as a review, an exanthem, skin rash arising from a foci of infection that is seen on the integumentary system. The enanthem, mucous membrane rash arising from another focus of infection. The term vesicle, bullae, macule, and pustule is seen here in illustration. Vesicle, again, typically around the size or less than the size of 1 centimeter. A bullae, typically when these lesions are larger than 1 centimeter. A macule, which is seen under the surface of the dermis. And then the pustule, which is a fluid-filled vesicle that contains pus. Microorganisms such as Staphylococcus can cause skin infections. Staphylococcus is a spherical, gram-positive bacteria, forms irregular grape-like clusters of cells. Staphylococcus aureus is the most pathogenic of the Staphylococcus. It forms a golden yellow colonies on an agar. Almost all pathogenic strains produce coagulase, which is an enzyme that coagulates the fibrin that's in blood. This actually helps Staphylococcus to be more virulent. Coagulase test is used to distinguish Staph aureus, which is the pathogenic form of this organism, from other species of Staphylococcus. The predominant species of coagulase negative Staphylococcus is referred to as Staphylococcus epidermidis. Staphylococcus epidermidis rarely leads to any type of disease abnormality, whereas Staphylococcus aureus is almost always the pathogenic form of this organism. Staph aureus produces a number of toxins, such as enterotoxins that affect the gastrointestinal tract, leukocidins, which destroy phagocytic leukocytes, exfoliative toxins, which are responsible for the scalded skin syndrome. Staph aureus is found primarily in the nasal passages and is a common hospital problem. In fact, methicillin-resistant Staph aureus, and we talked about methicillin resistance in one of the earlier lectures, is a common hospital problem. Universally present, its constant exposure to antibiotics causes rapid development of resistance in a hospital setting. The species, therefore, causes many infections of surgical wounds, other artificial breaches in the skin barrier, especially in hospitalized patients, can lead to these methicillin-resistant Staphylococcus aureus infections. Again, two Staphylococcus organisms, Staph epi, which rarely leads to a disease. It's a gram-positive cocci, but it is coagulase negative. Staphylococcus aureus, that causes disease, a gram-positive cocci, but it is a coagulase positive organism. It can also lead to a condition referred to as exfoliative toxin or the scalded skin syndrome. This is an electron microscopy of Staphylococcus on the skin. The term pimples, these are infections of the hair follicle, which are natural openings in the skin barrier, and eyelash follicle infection is referred to as a stye. Furuncles or boils are types of abscesses that are usually arising from hair follicle infections. In a furuncle, this is a region of pus that's surrounded by inflamed tissue. It's a more extensive invasion into tissue and is termed as a carbuncle. Again, just as a review, folliculitis, this is an infection of the hair follicle. A stye, folliculitis at an eyelash. A furuncle, abscess or pus surrounding inflamed tissue. Carbuncle, inflammation of tissue under the skin. The term impetigo of the newborn is troublesome for hospital nurseries. Prevention of this Staphylococcus infection is based largely on the use of hexachlorophene containing skin lotions. The circulation of bacterial toxins is referred to as toxemia, and when the outer skin layers peel away the reaction of Staphylococcus toxins, this is known as the scalded skin syndrome. The syndrome is one of the characteristic toxic shock syndrome caused by the growth of staphylococcal bacteria. As a review, impetigo, staph infection seen in the newborn. Later we'll talk about impetigo in children that are older. The causative agent in those cases are a streptococcal organism. When we see staph infections of the skin in newborn infants, it's referred to as impetigo as well. Toxemia, as we talked about, when we see a toxin that's been secreted by staph into the bloodstream. Also the scalded skin syndrome, which you're seeing in the picture here, which gives the appearance that the skin has been dipped in hot boiling water. This is actually related to the toxin from staphylococcal infection. And then the disseminated infection can also be seen in what's referred to as toxic shock syndrome. Streptococcal infections have similar presentations on the body. They can also attack the integumentary system as well. A group A beta hemolytic strep are a common causative agent of strep infections on the integumentary system. They have M proteins which bind to the outer surface of the cells, and we'll talk about M proteins in a bit more detail. Streptococcal skin infections. Streptococcus are gram-positive spherical bacteria that tend to grow in chains. They are aerotolerant anaerobes, and they do not use a catalase, a negative. And I said that wrong, I believe. They are catalase negative. Now, if you remember before, we talked about Staphylococcus aureus as being catalase positive. Catalases help to break down fibrin in blood. Now, catalase negative organisms in staph are staph epi. Catalase negative staph epi does not tend to cause disease. We're now seeing an organism that is catalase negative but still causes a disease. In streptococcal skin infections, they produce several toxins as well. They produce enzymes such as hemolysin. We also see group A beta hemolytic streptococcus such as strep pyogenes are some of the most important by the standpoint of human disease. The M protein, as I alluded to earlier, is distributed on the cell surface on fibrils, which is also the basis of subdividing them into 80 immunological types. This contributes to the pathogenicity and its anti-phagocytic properties as it aids in adherence. Also produced by these cells are erythrogenic toxins. We see this such as in scarlet fever rash. We also see deoxyribonucleic acids or deoxyribonucleases. These are enzymes that will degrade DNA. We also see streptokinases, an enzyme that will dissolve blood clots. We also see hyaluronidase. Hyaluronidase is an enzyme that dissolves hyaluronic acid. Hyaluronic acid, if you recall from early anatomy, is the cementing substance of connective tissue. This is how cells are held together. Now, these combinations of toxins and enzymes help to degrade tissue. In the process of degrading tissue, it allows the infectious organism to spread very rapidly throughout the system. So again, you should be familiar with deoxyribonucleases, you should be familiar with streptokinases, and you should be familiar with the term hyaluronidases. Strep pyogenes is the most common cause of erysipelas. This is a disease in which the dermis is affected and the skin erupts in a reddish patch. Usually it's preceded by a streptococcal infection such as a sore throat and elsewhere in the body. Impetigo is a superficial skin infection affecting grade school children, characterized by pustules, and becomes crusted and rupture. The bacteria enters through minor lesions, minor scrapes, minor bumps that you would see in a small child or school child from playground injuries. Staphylococcus often is present, but is probably a secondary invader. Now again, if you go back just a few slides, we talked about Staphylococcus as the cause of impetigo in newborn infants. In fact, it can run rampant in newborn nurseries. However, Streptococcus is the cause of impetigo in older children. Streptococcus may attack solid tissue. When that occurs, it's referred to as cellulitis. You should be familiar with that term and definition. Muscle covering, necrotizing fasciitis. It's when the infection gets into the fascial planes, the tissue layers that separate, say, subcutaneous tissue from muscle tissue. The muscle is separated by fascial planes, and when we see the Streptococcus infection invading into these fascial planes, it's referred to as necrotizing fasciitis. An exotoxin, particularly exotoxin A, acts as a superantigen, causing the immune system to contribute to damage. Now, if you recall when we talked about superantigens elicit a very aggressive immune response. And typically an immune response is what we want. We want the inflammatory cells to come there and try to get rid of these foreign invaders. However, in the case of a superantigen, it stimulates our immune system to respond too aggressively. When that occurs, it causes tissue damage. We already went through anaphylaxis, when the immune system secretes a significant amount of histamines. Histamines cause the secretion of inflammatory fluid. This can fill up the lungs and cause congestion. It also causes contraction of smooth muscles, which further squeeze down the airway and can lead to an airway obstruction. So exotoxins are an example of a superantigen, and again, this is where the immune system can contribute to tissue damage. These photographs on this slide demonstrate to you two disease conditions related to Streptococcus. You should be familiar with streptococcal infections as the cause of erysipelas. As you can see, the reddened lesion, the very bright cherry red appearance of this lesion, and then impetigo, crusted lesions that you can see also causing significant infection in the integumentary system. Impetigo by strep, again, is more commonly seen in older children, newborns. The impetigo is typically caused by staph infection. Again, some of the enzymes that are secreted by these organisms that lead to its virulence factor include streptokinases, hyaluronidases, exotoxins, which secrete into the system, are a form of a superantigen where it stimulates the immune system to add to the tissue damage. Deeper strep infections into tissue layers are referred to as cellulitis, and even deeper infections which enter into the fascial planes of tissue is referred to as necrotizing fasciitis, as demonstrated in the photograph here. Now, other infectious organisms that can invade the integumentary system include the pseudomonids, particularly Pseudomonas aeruginosus. You should commit that name to memory. Pseudomonas aeruginosus may cause a number of opportunistic skin infections. These bacteria are common in soil, water, and plants, and they grow in minimal organic material, resistant to antibiotics in many cases, and it often makes them a major problem in hospitals. Pseudomonas aeruginosus produces several exotoxins and endotoxins. Its nutritional demand is minimal. Pseudomonas can actually grow on the surface of water with very little nutritional or organic material available for growth. It may cause respiratory infections. It grows in dense biofilms in compromised hosts, especially in cases of cystic fibrosis. Cystic fibrosis, for those of you who are not familiar with this disease, cystic fibrosis is a condition in which the person's secretions, the respiratory mucosa, produces a very thick mucus. Typically, the viscosity of the mucus in our lungs is such that our lungs are able to cough out these secretions. But imagine sputum or mucus of the viscosity of oil, or even worse, as thick as maple syrup that's been refrigerated. That thick viscosity makes it extremely tough for the lungs to be able to cough out that mucus. And imagine if these high secretions or these thick secretions are in the deep recesses of the lungs. They actually can block or occlude the lungs, which lead to significant respiratory infections. Pseudomonas loves that environment. So patients with cystic fibrosis with this compromise in their pulmonary secretions can develop significant infections related to Pseudomonas. We also see Pseudomonas in burn patients whom the infection produces a characteristic blue-green pus or a pyocyanin pigment. Now, so two major populations of patients that can suffer from Pseudomonas infections include cystic fibrosis patients and burn patients, and you should be familiar with that. Infections from Pseudomonas also can cause otitis externa, also referred to as swimmer's ear. You should be familiar with that term. Swimmer's ear, otitis externa, caused by Pseudomonal infections. Skin infections collectively called Pseudomonads, Pseudomonad dermatitis, are contracted in such places such as whirlpool baths, and because the organism is relatively resistant to chlorine, it can proliferate in these types of environments. Gentamicin and carbenicillin are used in combination and are effective. Now, if you remember in the previous lecture, we talked about synergism. Synergism is when two antibiotics working together increases the treatment potential of these agents collectively. So we see gentamicin or carbenicillin used together to effectively treat Pseudomonas infections. We also see sulfasalazine. Again, this is a preparation that we talked about when we talked about antimicrobial agents. We see this commonly used in patients to treat Pseudomonas aeruginosus in burn patients. You should be familiar with sulfasalazine and its use to treat Pseudomonas infections in burn patients. Pseudomonas aeruginosus, gram-negative aerobic rods. Pyocyan produces a blue-green pus. Pseudomonas dermatitis, we see in otitis externa, commonly caused in swimming pools, and our exposure to the ear to swimming pools and our whirlpools. We also see Pseudomonas dermatitis in post-burn infections. And again, treatment regimens for this can be sulfasalazine, as we see in post-burn, and then gentamicin and carbenicillin for the treatment of other Pseudomonad infections. I want to talk a little bit about acne. Acne is a cosmetically unpleasing type of presentation in the integumentary system, primarily because acne presents itself on the face of the host. There are different forms of acne, and we'll talk about some of these different forms of acne and the causative microorganisms that lead to the disease. Comedonal acne occurs when the sebum channels have been blocked. They have been blocked by cells that have shed and blocked the ducts that would lead out the normal secretions. Inflammatory acne, this is called by propionic bacterium acnes. This is a gram-positive anaerobic rod. Typically, you treat it by preventing the sebum formation inside the ducts. Several agents can be used to treat that. Tazarac or isotretinoin is one such application that can be applied to the integumentary system to help prevent this formation. Also, certain antibiotics, many of the tetracyclines and or penicillins and cephalosporins can be used for these types of infections. Also, common over-the-counter agent now is benzoyl peroxide, which loosens the clogged follicles or the clogged ducts. You can also use visible or blue light to treat. This kills the propionic bacterium acnes bacteria, which has caused the infection. Severe forms of acne, nodular cystic type of acne, can also be treated with isotretinoin. Acne can be classified in three categories again: comedonal acne, inflammatory acne, and nodular acne, nodular cystic acne. Acne develops when channels of the passageways of the semen of the skin surface have been blocked. A sebum accumulates, whiteheads form. This is blockage will protrude from the skin, and a blackhead will form. This can be a painful lesion, and many attempts have been made to control these types of infection using topical applications and or oral antibiotic therapy. Comedonal acne is usually treated with topical agents such as tretinoin. Tazarac, as I talked about earlier, adapalene or differin is another solution that's used. They do not affect semen formation. They basically just clean it away and keep bacteria from proliferating in those environments. Inflammatory forms of acne arise in propionic bacterium. Acnes is the causative agent. It metabolizes sebum and causes an inflammatory response resulting in pustules and papules. Drugs that reduce sebum formation are called isotretinoin. Accutane is another popular used agent, is a brand name for it. Accutane fell under some disfavor several years ago because it was felt to cause episodes of depression in individuals who take it. Now, it does very much clear up a person's secretions quite effectively and can clear up very severe forms of acne. The drug found media attention several years ago when a legislator's son apparently committed suicide while on Accutane therapy. Due to the aggressive nature of this legislator, he had certain laws passed by the Food and Drug Administration which carefully governs the administration of Accutane. To administer Accutane, the provider typically has to go through specific continuing medical education course and gets a special permit from the drug manufacturing company to be able to prescribe the medicine. It is absolutely contraindicated to women who are pregnant. That is the main category of patient that is affected. It is a relative contraindication to patients who suffer from depression. Also used are non-prescription benzoyl peroxide compounds. Now the prescription strength dose of benzoyl peroxide is also available over the counter as well. Several years ago, weaker form of benzoyl peroxide was available, but now prescription strength dosages are available over the counter and are used in a number of preparations. Recent development of newer treatments in moderate inflammatory acne are the clear light system. This is the use of laser treatment or the application of light laser at a particular wavelength that can clear, as in the clear light system, that can clear the microorganisms that cause acne. The affected skin is exposed to a blue light that destroys propionic bacterium, acnes bacteria. Some patients progress to nodular cystic acne, and it leaves a prominent scar. Nodular cystic acne by far is the most disfiguring form of acne. Isotretinoin is the usual treatment for this as well. Another presentation of infectious organisms are warts. This is a form of a viral disease that presents itself in the integumentary system. There are more than 50 types of the papillomavirus, which causes uncontrolled non-malignant growth of skin cells, and these are referred to as warts. Warts can be spread by contact. The incubation period is usually several weeks. Treatment of warts include burning them with acids or the use of liquid nitrogen or cryotherapy or electrodesiccation. Genital warts have been successfully treated with infected interferon and with laser treatment as well. Papillomavirus is the causative agent of warts. Treatment is removal. You can do surgical removal, however, because this is a virus, the release of viral antigens into the bloodstream can occur with surgical removal. Imipramode can stimulate interferon production, and if you recall in our conversation about interferon previously, interferon causes or stops the production of viral agents. Interferon can be stimulated by the use of imipramode, which is why it is very effective in the treatment of papillomavirus.